afternoon, everybody. Slightly on later today. I'm looking forward to talking to Dr. Simone from Zita West Clinic, and we're going to be answering all of your questions. We've had a lot of questions, so we'll get through as many as we can. I'm just waiting now for Simone to come on and join me, and then we can get going, which would be great. Please ask questions as we're going through as well. We'll answer as many as we can in the time we've got. Okay, hi everybody. Just waiting for Simone now. Okay. He should be here any minute. Hello, Tamara. Come on, Simone. Oh, here we go. Any minute now, hopefully. Great. Simone!
Hi, hello Zita, good evening.
How are you?
Very well, thank you. Quite busy.
Have you had a busy day today?
Yeah, I mean, as always, it looks every day is the same. So, yeah, so we're actually very, very busy, Zita.
Yeah, how are the clients coping? Are they stressed or?
Well, yeah, I mean, no, I have to say that they're coping quite well.
Yeah. It's tough times to be doing IVF in, isn't it?
Yeah, they are. But I think those who decide to have treatment are really, really motivated, and you can see that actually they're coping very well. I think those who are not convinced prefer to delay this. Yes. But the other ones are really, really motivated, and also we are supporting them quite well, I have to say. So yeah, and Brilliant. They tell this to us that they feel they feel very supported, which for us is nice to hear.
Yeah, no, it's really important. I've got lots and lots of questions I'm going to go through, Simone. So, and people will be asking as we're going along as well. I think one of the things that we do at the clinic is around preparation, and there's been quite a few questions about science and evidence to support, what we're doing, and it's quite interesting, isn't it? Because I've been doing this for a long time. I've been a midwife for 40 years, and the clinic for 20, and it's interesting because when I first started, there was hardly any evidence on lifestyle or mindset. And it's becoming so important, isn't it, as part of preparation now for IVF. And in not just our clinic, but many clinics are talking about it or thinking about it. And certainly women know what they want, and they sort of seek those answers, looking about preparation and mindset and what I can do to increase my chances. So what are your views as a doctor? I mean, I know that you believe in everything that we're doing, but a lot of doctors don't, do they?
Yeah, a lot of doctors don't, but I respect everyone's opinion, but what I can just speak for my experience, yeah, I'm convinced that it plays a role, and we can see this in the embryo quality. We are told from our lab that so we share the lab with other doctors. We are not the only ones using the lab, and that's the best evidence, because we are often told by the people in the lab that our embryos are on average of better quality as compared to other embryos from other clinics and other doctors. And that's, to me, and the only thing we do differently is the preparation. That's why I strongly believe that this plays a role, because we use pretty much the same medication as other doctors. That there's no difference in that. So to me, the only other thing is the preparation that is having an impact, and also the mindset is very important, Zita, because this is not this is not, we cannot demonstrate this scientifically, but I can tell you from experience that those patients who are in a better mindset, in my experience, are those who, in the end, have better chances of succeeding. I see this
Yeah, I agree.
all the time.
I
It's not
agree.
explainable. It's not
Yeah.
explainable with the science, because there's no scientific explanation for that. But there must be something, because
Yeah.
we see that people who believe in that more, and they are more motivated, and they have a more positive mindset, in the end have better success rates. So there must be something.
There must, and it's interesting as well, because I think that one of the questions I always ask women coming through IVF, not so much now because we're in lockdown, but what else is going on in your life? And when you hear that they're moving house, they're doing extensions, they're flying all over the world, you've got to focus your energy, haven't you, on where you're at and what you're doing. So the first question to this is, does thinking negatively affect my IVF outcome? And, you know, we try and get people into the best mindset that we can, you know, and it's hard sometimes, because if you've had repeated failure after failure after failure, you don't want to feel hopeful, do you? You don't want to sort of, you just feel exhausted. You just want to get it over and done with. And I think the preparation, something different has to happen the next time round. You can't just keep doing the same thing.
I think what might provide a partial explanation to that is not the negative thinking in itself, are those biochemical changes which are connected to that. We know, for example, there are some stress hormones like cortisol, which is produced in response to stress. So if the negative thinking, as I believe it is associated, that is a source of stress for the patient, then we can't exclude that it might induce the body, and we know this is proven. There are a lot of data on that. The brain is responsible for the production of some stress hormones. Cortisol is one, but there are some others, which comes from stressful situation. So if the patient is thinking negatively or is worried about something, we can't exclude that patient might be producing some biochemical factors, which in turn might have an impact.
But also, Simone, you know, from my acupuncture point of view, and also physiologically, strong emotions such as fear and anxiety and grief, they all impact biochemically in the body, don't they? So it's sort of trying to help those women get through those situations. Okay, another one here: how to prepare for FET, frozen embryo transfer. We look at nutrition, don't we? And the same thing around mindset.
Yeah, I mean, for the same reasons, because if we believe that actually stressful hormones might have an impact, and again, this is proven. I read an interesting article a few months ago, by which the authors of that article gave some myorelaxants during the transfer. The same thing you use in obstetrics when you want to block contractions. Okay?
Yes.
They gave the same medication to relax the uterus, and they claim that they have a better pregnancy rate by doing the transfer under this condition than not administering that myorelaxant.
That's interesting, isn't it?
Yeah, but that is to explain. I mean, I'm not saying that you know, this is the truth, because clearly, in order to confirm that claim, you should replicate the study under the same condition and see whether you find the same results. Because you know, one can claim whatever, but then it has to be reproducible, and you need to be able to recreate that. But that provides a good support to say that all during the transfer, it's good to have the patient as much relaxed as possible, and that's when acupuncture might help, and having a positive mindset
Yeah, we
might
do it.
have.
I mean, we do IVF, acupuncture before and after transfer. But it's
Exactly.
interesting as well. I often think with transfer, it's quite a stressful time for a woman because she's been through so many hurdles to get to this space. And then she has to, you know, relax, and she panics that the uterus is going to, you know, contract. So, you know, really, really important that you've got that preparation and you've got some distraction skills to use while you're going through all of this. Right, another question here now. I have MTHFR. What can I do to optimize my chances of getting pregnant at 39?
Well, I mean, first of all, we have to.
And many women do have MTHFR.
Many women have, and for the heterozygous form, where only one of the gene is mutated, that is a very common variant. So it is supposed to be with no clinical significant evidence. So I would say for the heterozygous form, probably giving a more active form of folic acid is enough. The problem is where is homozygous. So both the genes of the MHFTR are mutated. That's when you need much more folic acid in the form of methylfolate. That's what
folate,
we give. Folate, not just the normal form, because the problem of these women with the mutation is that they do not metabolize the normal folic acid. So they need the active form, which is methylfolate.
Yeah, and that's important actually, because they're taking quite a high dose, aren't they? Around 5 milligrams, and the folic acid could be detrimental. It cannot be helping if it's not the right one.
Yeah, because it's not metabolized. So those women need the active form. That's how we treat it at our clinic. We need we give the active form, which is the methylfolate.
What thoughts on IMSI? We have had 3 failed rounds of ICSI and wonder whether using a clinic that offers IMSI is a good idea, as it limits our clinic choice.
Well, you know, we have seen in our experience that IMSI, if you can do the normal standard ICSI quite well, actually the impact of IMSI is marginal. What I think is more important is to select the right sperm properly with ICSI. So it's all about doing ICSI properly. IMSI, in my experience, is helpful only in very, very, very few cases where basically pretty much all the sperm is not good from a morphological point of view, and really you need to magnify with a very, very potent microscope. That's IMSI, the selection of the sperm, but that happens very, very rarely. What I would rather do, and we have started doing this very recently in collaboration with Care London, which is the lab we use, is to select the sperm actually with a method called ZYMOT, ZYMOT. This is a very, very innovative way to select the best sperm for ICSI, and the results are very promising. So either than doing IMSI, I would be curious to see whether selecting the sperm with the ZYMOT, and we have started doing this now for our
How
patients.
exciting. Yeah,
it's very exciting. As I say, the results are very promising. We have done already a few with good results.
And do you do that? When is it done? Is it done before?
No, it's done at the same time. The patient have the ICSI, the standard ICSI. It's just that instead of selecting the sperm in the usual way selected, the lab applies this new method, which seems to select the sperm better. So it selects the best sperm much better than in the standard way.
Okay. And what about, while we're on it, DNA fragmentation is another that has come up here. So again, you know, that's something that you can do, isn't it? And it helps in terms of looking at the ROS of the sperm.
Yeah, again, again, the DNA fragmentation, having a high level of DNA fragmentation is supposed to be an indication for ICSI.
ICSI, yeah, rather than
even when all the parameters look fine. So even with a normal semen analysis in terms of count, motility, and morphology, when the DNA fragmentation is high, there seems to be a common agreement between doctors to do ICSI.
Yeah.
And again, I will be curious to see, but in order to give an answer on that, I need more time. But I do think that actually the Zymote could provide a good treatment options also for this for this couple having high DNA fragmentation. Because it's about finding the right sperm.
Yes, it is. But is this an expensive test for couples to have?
Not at all. At the moment, we are offering this free of charge.
Oh, right. God, my goodness, that's great. And obviously there's information about it on the website or whatever, or, you know, in the clinic.
Yeah, I mean, I don't know if as I said, is relatively new. I don't know whether there is already an information on that, but if not,
we should do. Yeah,
I will
check.
Do it soon.
Yeah, I will check. Okay.
Yeah.
Another question here. I've just had my 4th IVF transfer, and unfortunately, it's ended in another chemical pregnancy. I have unexplained infertility. And I'd love to know what I can do to focus on conceiving naturally, if at all possible. So with someone like this, who's had a 4th IVF transfer and it's resulted in a chemical pregnancy, apart from supplements and lifestyle, what other medical things can this woman do?
Well, I mean, as always, it is fundamental to understand the reason for the failures.
Yeah.
Whether we think is more an embryo problem, on which age has a huge impact, because age is still the main factor determining the genetic unviability of the embryo. So if we think that could be more of a problem, then probably we should suggest to screen the embryo genetically to see whether the embryo is normal to start with. Whereas if we think the problem might be different, like, for example, an immune issue affecting implantation, then we can do some investigations into that. So we should have an idea first of what the problem is, because the patient might fail several times, always for the same reason. So it would be good to understand what's the reason behind that, to give advice.
I mean, that's the frustration for many clients. We see a lot of women that have failed at other clinics, but this whole thing that it's just a numbers game, you have to just keep going, isn't true, I don't think. And certainly with the way that you work and the other doctors at the clinic work, it's really sort of like doing a good foundational consultation and working out what happened last time and what can be different or improved on this next time round.
Exactly, Zita. I don't believe in bad luck. I never say to a patient, oh, it's bad luck.
Yeah.
Because to me, it doesn't mean anything. What means bad luck?
Yeah.
You know, there's always a reason. And the object of a good consultation is to try to find what is the most likely reason for the previous failures, and tell the patient very honestly and very openly what we can do. Sometimes you come to the conclusion that there's not too much we can do, and we have to be very honest and tell our patient.
You've frozen a bit on me, Simone. See if he comes back. Oh, he's left. I think he's probably going to try and come back in again. Let's just see. Let me answer a couple of questions as we're waiting for Simone to come back. I'm really sorry about this. Another question here is, I have PCOS. I'm 39. I work out to help with weight management. Should I change my fitness routine before trying to conceive? The difficulty about this lady is, you know, at 39, there's a very, very fine line you have for trying naturally or going down a route of assisted fertility, such as an IVF. So the weight management is important, and it will depend, and I haven't got it down here, on what this lady's BMI is, because there's a certain cutoff point to what your BMI is to be able to access IVF, both privately and on the NHS. So I would be encouraging her to lose weight and try naturally if she has a high BMI. Okay, what's the best thing we can do with high DNA fragmentation for sperm? 52%. And what's difficult about these tests, and I think they're very, very good, because what having a DNA fragmentation test, what it will do is it is able to give the doctors an idea of whether you're going to have IVF or ICSI, but going straight to ICSI rather than doing IVF, which has a higher chance of failing. So that's what it gives the doctors a good idea about doing. But also, it's very difficult in the treatment of sperm DNA. There are lots of vitamins and minerals and supplements out there. And for some, it makes a big difference. For others, it doesn't make a huge difference. But it's definitely worth trying. Certainly with lifestyle, if you're smoking, if you're drinking lots of alcohol, doing drugs or anything like that, that can be an important factor. Jacuzzis, saunas will affect the sperm as well. So doing absolutely everything you can, but you do stand a chance if the DNA is high with doing something like ICSI. Okay. I am 34. I've been trying for 18 months, trying naturally with tracked ovulation, regular 28 to 32 day cycles. Post LH kits show that I'm ovulating. I keep trying naturally, but I'm told with unexplained fertility, we should think about IVF. It's a difficult one, this, isn't it? Because 18 months is quite a long time to try, especially if you're having lots of sex. She's 34, so this lady is still young, which is a good thing. She's done everything about tracking ovulation, etc. I think one of the things that needs to happen is that she obviously must have had blood tests in these 18 months, because many women think if they're having periods, they're naturally ovulating. That's not always the case. So a blood test is important here. And I think, you know, two of the things I always look at when I see a woman is, one, her age is good, but also the length of time trying. So 18 months is quite a long time, because there's no guarantee you're going to get pregnant. You're going to get pregnant when you're going to get pregnant. So I think there may be a few months when there's something you could do before you go down an IVF route, a softer approach. But really, if it's not happening and there's no known causes, then rather than keep on trying, you are looking at the route to IVF. And obviously the first port of call is your GP, see if you can get treatment available on the NHS, but different parts of the country have different criteria. Okay, I started my first private cycle of IVF in 2016, 14 eggs retrieved and 8 mature. That's fantastic. 4 fertilized, 2 blastocysts, fresh transfer, 1 blastocyst. I took progesterone and started bleeding on day 6. Is there anything I can do this next time round? Well, it sounds from this lady that she's got excellent AMH, egg reserve, which is good. And, you know, really, it's the first cycle she's had. I don't know if she's got any frozen embryos, but things, you know, are looking good for her. I don't know what her age is, but her AMH and the egg she's producing is good. So going back for a referral and talking to your consultant is really important. There's another one here as well, which I see so much on with secondary fertility issues. And this is a lady who is 36. She's had 1 baby. She said, I don't understand. I got pregnant without thinking the first time round. And now I'm really struggling. I've been trying for over a year and I never thought this would happen to me. I hear that time and time again with women that are trying the second time round. And I think there's a few things that you need to look at from the medical side, but also from the lifestyle side as well. So very often, if you're not getting pregnant, just doing medical checks to see if you're ovulating, see what your hormones are doing, looking at your thyroid. Many women's thyroids change when they've had one baby. They might be out of kilter. So that's worth looking at. Looking at your cycles to see how regular, or if there's any irregularity in them, is key. But also looking at what's going on in your life. You know, so often when you've got a little one, and many women that we see, because they're older when they get pregnant and do IVF, they want to start another round of IVF or start trying while they're still breastfeeding, or the baby's about 10 months old. So very often it can be just through to sheer absolute tiredness, a baby in bed with you, not having enough sex, still in that baby fog. So, you know, really look at what's going on in your lifestyle when you're trying, but don't leave it too late to get help either. And we do a lot with mindset for this, because again, there's no end of reasons why women may have secondary fertility issues. Sometimes it's trauma around the first birth, it's exhaustion, it's tiredness, all sorts of things come into the mix. Right, what else have I got here? Have I got any more questions here? No, I haven't. So if any of you want to ask me any more questions, please do. One I've forgotten here. I've been told to use donor eggs at 30. Oh my goodness. Is there any other option or worth a second opinion? This is a difficult one, because I've got no history here of why this woman has been told to use donor eggs, whether she's got a premature menopause or what. I have no idea, but it seems very hard at 30 to be told to use donor eggs. So it would be interesting to know what her full history is. Anyway, Simone hasn't come back on. I'm really sorry about this, because it was going very well, and I think we were getting around to lots of your questions. So I'm going to go off now, and I'm back next. I'm back on Wednesday with Lou, one of our acupuncturists. So please send any acupuncture questions in that you have for her. And then the following week, I'm on with Jane, our counsellor. Thank you so much for watching this evening. And I'm really sorry Simone hasn't been able to finish off all the Q&As, but I'm sure he'll be back on soon. So thank you, and I will see you shortly.